Lower limb coldness, numbness, tingling, crawling sensation, and water retention can be caused by various reasons, including the following common conditions. 1. Circulatory system abnormalities can lead to impaired blood circulation, reducing the blood supply and oxygen delivery to the lower limbs, resulting in insufficient blood supply. These may include arterial stenosis, refers to the narrowing or blockage of the inner channel of the arteries, leading to restricted blood flow. Varicose veins are abnormally dilated veins with impaired blood reflux, commonly found in the lower limbs. They can cause circulatory problems, increased venous pressure, and result in lower limb swelling and discomfort. Blood clot formation. Deep vein thrombosis in the lower limbs refers to the formation of blood clots within the deep veins. In severe cases, the blood clot may dislodge and cause pulmonary embolism. Arterial inflammation involves inflammation of the inner layer of the arteries, leading to vascular wall damage. Narrowing and impaired blood supply, causing abnormal sensations and swelling. These circulatory issues may be related to genetic factors. Lifestyle factors, such as an unhealthy diet and lack of exercise, diabetes, hypertension, hyperlipidemia, obesity, and more. 2. Abnormalities in the nervous system can also cause abnormal sensations in the lower limbs. Sciatica is pain and discomfort caused by benign or malignant compression of the sciatic nerve. The sciatic nerve extends from the lower back to the lower limbs, and compression of the nerve can cause leg pain, numbness, tingling, and swelling. Multiple sclerosis is an autoimmune disease that can cause damage to the nerve myelin, and the lower limbs are commonly affected. Diabetic neuropathy is one of the complications caused by long-term high blood sugar levels damaging the nervous system. Spinal cord injury can cause sensory and motor dysfunction in the lower limbs. The severity and location of the injury determine the severity of symptoms. Nerve root compression. Problems such as degenerative changes in the spine, herniated discs, or spinal deformities can cause compression of the nerve roots, resulting in lower limb nerve symptoms. 3. Diabetes can lead to peripheral nerve damage, known as diabetic neuropathy, which can cause abnormal sensations in the lower limbs, including numbness, tingling, and crawling sensations. Common lower limb symptoms associated with diabetes include diabetic neuropathy. Prolonged high blood sugar levels can damage the nervous system. Diabetic vascular disease. Diabetes can damage blood vessel walls, leading to arterial or venous diseases in the lower limbs, affecting blood supply and circulation. Diabetic foot problems. Diabetic patients are prone to foot complications such as ulcers, infections, and neuropathic bone changes, which can cause lower limb pain, swelling, and limitations. 4. Sports injuries. Overuse or injuries can lead to lower limb swelling and pain. For example, sprains, fractures, or muscle strains can cause local inflammation and swelling, resulting in discomfort in the lower limbs. 5. Abnormalities in the lymphatic system can also cause swelling in the lower limbs. Poor lymphatic circulation may be due to blockage of lymphatic vessels, enlarged lymph nodes, or other lymphatic system issues. Congestion. Poor venous blood flow can lead to venous congestion in the lower limbs, causing swelling. This may be associated with prolonged standing or sitting, varicose veins, or blood clot formation. Lymphatic circulation issues. Blockage of lymphatic vessels, enlarged lymph nodes, or other lymphatic system problems can disrupt the normal flow of lymphatic fluid, leading to fluid accumulation and swelling in the lower limbs. Edema. Retention of fluids in the body can result in lower limb edema. This may be associated with heart disease, kidney problems, liver disease, pregnancy, or certain medication side effects. Inflammation and infection. Inflammatory reactions or infections in the lower limbs can also cause swelling. For example, deep tissue infections, cellulitis, or erysipelas. Medication side effects. Certain medications, such as calcium channel blockers, hormone medications, and non-steroidal anti-inflammatory drugs may cause swelling in the lower limbs as a side effect. These are just some common causes of lower limb swelling, and the specific cause needs to be assessed based on the patient's medical history, symptoms, and physical examination. 6. There is another type of lower limb edema that is often overlooked by medical professionals and experts, which is associated with hormonal changes during perimenopause and menopause. This menopause-related edema is usually generalized or primarily occurs in the lower limbs, and often does not have other obvious symptoms. In addition to hormonal changes, other factors such as genetics, diet, body position, environmental temperature, and lack of exercise may also affect the degree of edema. Menopause is a stage in a woman's physiological cycle, accompanied by the gradual decline of ovarian function and changes in hormone levels. This may affect the water and salt balance of the kidneys and the regulatory function of blood vessels. This can lead to fluid retention in the interstitial spaces, especially in the lower limb area, resulting in edema. Although menopause-related lower limb edema is recognized in clinical practice, it is sometimes overlooked or attributed to other factors. For menopausal women experiencing lower limb swelling, it is recommended to seek evaluation from a doctor or specialist to exclude other potential causes and receive appropriate management and advice.